Welcome. We're so glad that you're here. You might be here for a variety of reasons. Maybe you or a loved one has been diagnosed with sleep apnea. Maybe your child struggles with bedwetting, attention issues, or restless sleep. Or maybe you're just tired of your partner's snoring. At first glance, these issues may seem unrelated, but as we go through this presentation, I think you'll start to see the common thread. And more importantly, you'll discover that there are real solutions. So let's get started. Let's start by taking a look at this group of kiddos. When you first look at this picture, what do you see? Most of us would say these kids look happy, bright, and healthy, and they absolutely do at first glance. But now that I know what I know about airway health and facial development, there are some more subtle signs that stand out. Take a look at the little girl in the bottom right. Her teeth appear almost too big for her mouth. This could be a sign of a narrow arch or crowding. Now, the girl in the top center, notice that when she smiles, you can see quite a bit of the gum tissue above her upper teeth. We call that a gummy smile, and it can sometimes indicate altered growth patterns in the upper jaw. And the little guy here in the striped shirt on the right side, he's adorable, but he looks like he pulled an all-nighter, and kids shouldn't look like that. It may be a subtle sign that he isn't getting restful sleep. So what looks normal may actually be signs of an underlying issue, ones we can catch early and support. There's a silent crisis happening. Take a moment to read through the list. These symptoms and conditions may seem unrelated, from bedwetting and difficulty in school to anxiety, diabetes, and even early death. But they often share a common, overlooked root cause: compromised airway and poor sleep. Research has shown that untreated sleep and airway issues can contribute to serious physical, emotional, and cognitive challenges, starting in childhood and continuing throughout life. Could all these symptoms be connected? Let's take a look at this tree. The leaves and branches represent visible symptoms, the things we notice and experience every day, like restless sleep, mouth breathing, bedwetting, and difficulty in school. But what if these symptoms are just a result of something deeper? At the trunk, we see the underlying cause: a compromised or underdeveloped airway. And beneath that, at the roots, are the possible contributors to how we got here. Things like low tongue posture, a weak tongue, tongue thrust, soft diets, and limited breastfeeding. Now let's take a look at it from the bottom up. If a child has low tongue posture or weak oral muscles, these issues can lead to a compromised airway. And once the airway is compromised, the symptoms start to show one by one in different ways. When we address the root cause, we have a chance to support real lasting health changes and not just treat the symptoms. Where is this coming from? Why are we seeing so many children with crowded or crooked teeth? Why do nearly 80% of kids today need braces or orthodontic treatment? The truth is, this isn't just about genetics or bad luck. Something in our modern environment and habits is changing how our children grow and develop, especially their jaws, faces, and airways. What we're seeing is a reflection of deeper changes in the way we eat, breathe, sleep, and use our muscles, starting from infancy. Let's take a closer look at what might be really driving this trend. Let's take a look at this image of the skull. The inner line represents the size and shape of a skull at just 2 years old, and the outer line shows what it looks like at 17 years old. What stands out is how much of the growth happens in the lower third of the face. This is where the jaws and airway structures develop most significantly. But here's something even more important. By the age of 2, a child's face is already 55% developed. By age 4, it's 75% developed. And by 12, it's around 92% developed. So most growth happens before the age of 12. We know that normal craniofacial growth occurs in a forward, downward, and outward direction. That growth is critical not just for smiles, but for breathing, sleeping, and long-term health. This is why early screening matters, because by the time a child is 12, most of the foundational growth is already done. Why are we seeing so many children and adults with abnormal growth and development? What's changed in our environment, habits, or daily lives that could be impacting the way we grow, especially our faces, jaws, and airways. Let's explore some of the surprising, often overlooked causes. But to help us answer this question, let me introduce you to Dr. Robert Corricini. Dr. Corricini is a renowned anthropologist with over 30 years of research and hundreds of published studies. His work has helped shed light on how our modern environment has impacted facial and jaw development. Today we'll be looking at two key areas of his research: his fossil studies and his population studies, both of which offer valuable insight into how and why growth patterns have changed over time. When Dr. Corricini studied prehistoric human skulls and compared them to modern skulls, he discovered something striking. The prehistoric skulls had much larger upper and lower jaws, with enough space for all 32 teeth. That's including the wisdom teeth. There was very little crowding or crookedness, and of course, there were no orthodontists back then to align teeth. But fast forward to today. Most people don't have room for their wisdom teeth at all. And even with just 28 teeth, crowding and misalignment are extremely common. So what changed? The answer isn't in our genetics. It's in our environment and how we use our jaws during early development. Dr. Corricini also studied isolated rural populations from around the world. These were groups of people not exposed to modern influences like processed foods or infant formula. What he found was remarkable. In these populations, children were breastfed for extended periods, often 2 to 3 years. Their diets consisted of tough, chewy foods like dried meats and hard root vegetables, requiring strong jaw function during eating. And the results? These populations showed almost no signs of crowded or crooked teeth. Their upper and lower jaws were well developed and properly formed, without orthodontic intervention. This tells us that jaw development is functional. It depends on how we use our mouths from infancy onward. Dr. Corricini noticed a powerful trend in his population studies. As Western culture and soft processed diets were introduced into previously isolated populations, he observed a dramatic rise in malocclusion, that is, crowded and crooked teeth. In the first generation after this dietary shift, about 50% of people began experiencing malocclusion. By the second generation, that number rose to 70%. And by the third generation, a staggering 85% were affected. What this shows us is that these changes in the jaw and facial development don't take centuries. They can happen in just a few generations when function and nutrition are altered. This isn't just about teeth, it's about how we grow. Here are Dr. Corricini's key conclusions from his research. Dietary consistency and toughness are critical. They help promote proper bone growth, especially in the jaws and face. When processed, non-resistant foods became common after industrialization, there was a rapid rise in malocclusion. Crooked teeth became the norm rather than the exception. A soft diet or highly processed foods lead to the underdevelopment of the upper and lower jaws, increasing the risk of crowded, crooked teeth. His work highlights something incredibly important. It's not just what we eat, it's how we use our mouths in those early years that can shape a lifetime of health. Let's put this into perspective. It takes 27,000 years for a genetic mutation to express itself in just 51% of the human population. So how is it that malocclusion, crowded, crooked teeth has become so common in just 1 or 2 generations? This tells us something important. Malocclusion is not inherited, it's acquired. It's not a genetic issue. It's the results of cultural changes, our diets, habits, and the way we use or don't use our jaws as we grow. Dr. Corricini's conclusion was clear. Malocclusion is a disease caused by Western culture. So what does Western culture influence actually look like? It looks like shorter breastfeeding duration and softer diets. Today, most babies are breastfed for just a few weeks or months, far from the 2 to 3 years seen in our traditional cultures. After that, we often introduce bottles and pureed foods. But here's the important part. There's a big difference between breastfeeding and bottle feeding. When a baby breastfeeds, they have to work hard using their tongue, lips, jaw, and facial muscles to draw the milk out. With a bottle, the milk flows more freely, the tongue stays low and back, and much less muscle effort is required. But why does this matter? Because bone growth follows muscle activity. If muscles aren't activated properly during the feeding, the bones, especially in the jaw and face, don't grow the way they're supposed to. These early feeding habits play a powerful role in shaping a child's future airway, bite, and facial development. So here's what we know from the research. Most malocclusion is acquired, not inherited. This means it's not just something you're born with, it's something that develops based on your environment and habits. Malocclusion is unique to Western culture. Traditional and isolated populations simply don't experience crooked teeth at the rates we do until they adopt modern habits. And here's the most important point. The presence of malocclusion is the key indicator of an underdeveloped airway. I want to say that again. Crooked teeth are not just a cosmetic issue. They're a red flag that the airway may not have developed properly. And that's why early screening, awareness, and intervention are so important. This is Dr. James Sim Wallace. He was one of the early voices connecting diet and development. What Dr. Wallace found was that an early soft diet can actually prevent the tongue from developing properly. A soft diet doesn't provide enough resistance to build strong tongue muscles. Without that strength, the tongue cannot properly press against the palate or support the spacing of the baby teeth. And as a result, the jaws don't develop fully and the crowding of permanent teeth becomes more likely. In other words, the tongue plays a key role in shaping the dental arches, but only when it's strong and active during those critical years. We know that having a strong, well-developed tongue is critical to proper jaw and facial growth. This visual helps explain why. The tongue acts as a scaffold, a natural expander for the upper jaw. When the tongue rests properly up against the roof of the mouth, it provides gentle, constant pressure that helps guide the jaw outward and forward, supporting a wide, healthy arch form. On the left, you see a structure that mimics what the tongue should do. Press upward and outward to build a strong, supportive shape. On the right, you see a healthy upper arch. What can develop when the tongue is in the right place and doing its job? Without the scaffolding, the arch can collapse inward, leading to crowding, crossbite, and airway compromise. But when your tongue is not strong and does not function properly, like when it sits low in the mouth instead of pressing up against the palate, you often end up with a narrow V-shaped arch, also known as a Gothic arch. This type of arch doesn't leave enough room for all the teeth, leading to crowded and crooked teeth. But when the tongue is strong and maintains proper posture, resting fully against the roof of the mouth, it encourages the development of a wide U-shaped arch. This natural expansion creates space for all the teeth to come in properly. So, the shape of your arch is a reflection of how your tongue functions during growth. Let's talk about the maxilla, or the upper jaw. Many people think of it as just the bone that holds your upper teeth, but the maxilla actually does so much more. It forms the roof of the mouth, the floor of the nasal cavity, the sinus walls, and even the lower portion of the eye sockets. In other words, when the upper jaw is underdeveloped, it can impact breathing, sinus health, facial balance, and more. This quote from Dr. Christian Guillemont, the Stanford physician who coined the term obstructive sleep apnea, says, "Our results suggest that dental arch expansion improves sleep-disordered breathing in patients with upper and lower jaw constriction and can be a valid treatment. The research shows that expanding the dental arches doesn't just help with crowding, it can actually improve breathing and treat sleep-related issues in both kids and adults." This image also helps us understand the importance of jaw development in airway function. The upper and lower jaws aren't just there to hold the teeth. They play a critical role in shaping the airway. If the upper jaw is underdeveloped, it can narrow the nasal cavity, making it harder to breathe through the nose. An underdeveloped upper jaw may also trap the lower jaw, preventing it from moving forward to its natural position. And when the lower jaw is held back, It reduces the size of the lower airway. So a narrow, underdeveloped jaw isn't just a dental issue. It can lead to restricted breathing and sleep-disordered breathing that affects overall health. What does your airway look like? What does your child's airway look like? And which airway would you rather have? A narrow straw or a wide garden hose? Now, this next video really does sum it up. If you've been wondering why this matters so much or how it all ties together, this is a great video from Right to Grow organization with an incredible summary.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition, however, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
This is a powerful and clear example of what it looks like when a child is struggling to breathe during sleep. This is what airway obstruction can look like in real life.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. Still holding his breath, and I was going to gulp again. And there he goes. That was it again. And again. He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can. We'll see if I can. And I open his airway. Just bringing his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose. And I brought his airway. I'm opening his airway. Just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose. Just by, you hear how quietly he's breathing, you don't hear him anymore. And all I did is gently bring his jaw forward.
So what happens when the upper jaw is underdeveloped and someone can't breathe properly through their nose? They start to mouth breathe, and that creates a cascade of problems. When you breathe through your nose, the air is warmed, it's filtered, and it's humidified. This protects your airway and lungs. But when you breathe through your mouth, that doesn't happen. Instead, dry, unfiltered air goes straight to the back of your throat, irritating the tissues, especially the tonsils, which then often become inflamed and swollen, making nasal breathing even harder. But there's more. Your sinuses produce something called nitric oxide, a powerful vasodilator, and that means it helps your blood vessels absorb oxygen more efficiently. When you breathe through your mouth, you bypass the sinuses, and the oxygen you take in is less effectively absorbed by the body. So nasal breathing isn't just about comfort. It's essential for proper oxygen delivery, immune support, and overall health. What do we know about nasal breathing? Breathing through your nose isn't just natural. It's essential for healthy development and overall well-being. When you breathe through your nose, you get several key benefits. The air is filtered, it removes dust, allergens, and pollutants. It's humidified, which protects your airway and lungs from dryness and irritation. And your oxygen uptake is enhanced, thanks in part to the nitric oxide produced in the nasal passages, which helps your body absorb oxygen more effectively. Nasal breathing supports everything from immune health to sleep quality, and it is one of the most powerful, underappreciated tools we have for wellness. Let's take a closer look at the many benefits of nasal breathing. Nose breathing is powerful because it allows your nasal passage to do what it's designed to do. Lower your risk of snoring and sleep apnea, support healthy jaw and facial development, including proper teeth alignment, filter out dust, allergens, and harmful particles, humidify and warm the air before it reaches your lungs, improve airflow to your blood vessels and nerves, increase oxygen absorption and circulation, improve lung capacity and strengthen the diaphragm, reduce the risk of allergies, hay fever, and chronic coughing, and most importantly, it helps to support your immune system. All of these benefits come from something as simple and natural as breathing through your nose. This research comes from Dr. Eagle Harvold. Dr. Harvold conducted a groundbreaking study on young rhesus monkeys to better understand how airway obstruction affects growth and development. In this study, he intentionally blocked monkeys' noses, forcing them to breathe through their mouths. What he found was that the monkeys developed low tongue posture, they began mouth breathing, and over time they developed crowded, crooked, and misaligned teeth in the jaws. His research clearly demonstrated that nasal obstruction leads to mouth breathing, which leads to low tongue posture, which leads to malocclusion. It's a powerful reminder that how we breathe directly affects how we grow. Dr. Stenlinder Aronson conducted research focused specifically on children. He studied the differences between children who were natural nasal breathers and those who were chronic mouth breathers. What he found was clear and consistent. Children with nasal obstruction were more likely to breathe through their mouths, which led to lower tongue posture and ultimately to higher rates of malocclusion. He confirmed what many of the other studies have shown. The way a child breathes shapes how they grow. When nasal breathing is blocked, the body adapts, but in ways that can cause long-term developmental issues. So how does all of this connect to ADD or ADHD? I want to introduce you to Dr. Ben Moralia. He's going to explain this link in more detail. He's going to walk us through the connection.
We learn a lot about behavioral issues from a researcher, Dr. Karen Bonnick. Dr. Karen Bonnick did research to show that there was a correlation between sleep disorder breathing and behavioral issues in children the next day. And what we mean by sleep disorder breathing is really anything other than silent and invisible nose breathing. So the parent who recognizes that their child is sleeping and their mouth is closed and they're breathing through their nose and that breathing is silent and invisible, that would be a really good form of breathing for getting an excellent quality night's sleep. That pathway leads to refreshing, rejuvenated sleep that the child would wake up, ready to tackle the next day in a format where their behavior would be excellent and they would be attentive to all the details they needed to do at school. But the child who mouth breathes or worse, because the sleep disorder breathing category basically is everything other than silent, invisible nasal breathing. So when you are mouth breathing or worse, which could be snoring or even apnea type episodes, mouth breathing or worse, that disrupts the quality of the sleep. So with mouth breathing going on or worse, that child has a disrupted quality of sleep. And in the fancy words, we say sleep fragmentation. But for lay terms, we think about sleep deprivation. And so mouth breathing or worse disrupts the sleeping pattern, which disrupts that restful, rejuvenated technique that should be happening to set you for the next day. So basically, you wake up, even if you slept the right number of hours, it's not a quality night's sleep thanks to the breathing. But now without that good quality sleep, it's as if you were sleep deprived, and waking up sleep deprived does have a relationship to your behavior the next day. Dr. Karen Bonnick showed that the children who have sleep disorder breathing were 50% more likely to be diagnosed with ADHD.
This ADHD research article highlights the connection between airway health and behavioral symptoms. In this study, children between the ages of 5 and 12 with symptoms of ADHD were treated with a monoblock appliance, an MOA. Here's what they found. The study used parent survey questionnaires to track changes. And after 7 months of treatment, 61% of children showed improvement in their ADHD symptoms. These changes were statistically significant. And most importantly, it showed that by addressing sleep-disordered breathing, we could reduce behavioral symptoms that are commonly diagnosed as ADHD. This doesn't mean that every child with ADHD has an airway issue, but it does mean we should be asking questions and screening for airway and sleep quality. Now you might be wondering, how is this all connected to bedwetting? Let's go back to Dr. Moralia to explain.
Let's talk about bedwetting. So, bedwetting. Let's talk about bedwetting. So, bedwetting, it's the best kept secret among families because no one's really trying to share that with anybody. We do ask that question because there's a possibility to help that child. So, bedwetting, basically we have this release of fluid. It comes from the kidneys having to do more filtration. Well, if the kidneys have to do more filtration of the blood, it means there's more pumping of the blood going on. So we get to the heart rate and the blood pressure. Well, why would the heart rate and the blood pressure be increasing? Well, it turns out the pathway to increasing your heart rate and your blood pressure at night comes from sleep disorder breathing. So if we're mouth breathing or worse, the heart has to work harder to move the blood around to share the oxygen with the rest of your body. And when the heart rate goes up and the blood pressure goes up, all of a sudden now that excess use of the heart and the heart rate have to then be filtered more. The kidneys have to filter more, we have more water to release, and we can't make it the entire night without releasing it. Children wet the bed. Adults wake up to go to the bathroom more often. The pathway is the same. More filtration, higher heart rate and blood pressure, and of course it comes from
Now let's take a look at this research article published by the Journal of Sleep Disorders and Therapy. This study examined children between the ages of 5 and 12 who were experiencing bedwetting and who also had signs of sleep disordered breathing. These children were treated with a preformed monoglottic oral appliance, which helps support the airway during sleep. Here are the results. 97.3% of children showed a decrease in bedwetting episodes. Even more impressively, 54% of them completely stopped bedwetting within just 14 days of starting treatment. The remaining children saw improvement over the next couple of months, on average around 2.5 months. What this tells us is powerful. When we address sleep and airway, we often see bedwetting resolve naturally, without medications, alarms, or long-term therapy. It's another reminder that bedwetting isn't always a behavioral or bladder issue. It's often rooted in disrupted sleep and poor oxygenation. In the next video, Dr. Morelli is going to talk about clenching and grinding. We often think of teeth grinding as a dental problem, but what if it's actually a symptom of something deeper?
Nose breathing is so important to human beings that the body has a protective mechanism to make sure that it keeps it going nicely for you. So obviously a lack of oxygen would be very bad for a human being, and we don't get a whole lot of time without oxygen, maybe about 3 minutes or 180 seconds. So your body built a mechanism way upstream from oxygen dropping to make sure you never get to oxygen dropping. So as we start to breathe through our nose and there's resistance, meaning the airflow is poor through the nose, the body has a mechanism to help the air get through better. And that mechanism happens to be in the clenching and grinding of the teeth. So the pathway by which that works is that when the nose doesn't get the air in very well, the mouth will open to allow some air to get in there. But that doesn't usually improve how well we are oxygenated and how the exchange of the gases is occurring. So what the body then does to try to improve the breathing is it snaps the jaw shut, and then they grind around a little bit. So now clenching and grinding is really the body trying to reposition the jaws, which means reposition the tongue. If the body clenches and grinds enough that the lower jaw moves enough and the tongue moves enough, the air will get by better. If the air gets by the tongue better, the body is happy about that, so it stops the process. So basically we go through cycles at night of mouth closed with nose breathing, then mouth open with mouth breathing and nose breathing, a mixture, but then clenching and grinding as the body recognizes it doesn't like how the air is flowing, it wants to reposition the tongue. It is an airway protective mechanism, so clenching and grinding is unhealthy at any age. It is not something that is normal or we would ever outgrow. A child who is clenching or grinding their teeth has an airway or breathing issue.
So everything we've covered, the symptoms, the research, the causes, you might be wondering, what can we possibly do? How do we take all of this knowledge and actually help our kids and ourselves? The good news is there are answers, there are options, and there's hope. We don't need to wait for symptoms to get worse. We can start by identifying the signs early, understanding the root causes, and exploring treatment paths with focus on growth, development, and airway health, not just symptoms. So we offer several treatment options depending on your age, development, and specific needs. These fall into 3 main categories. Preventative, this is where we can make the biggest impact. Early screening, guidance, and interceptive care starting as young as 3 years old. Our goal here is to support proper development before problems arise. Management. We also offer management solutions specifically designed for adults who have been diagnosed with mild to moderate sleep apnea. For many of these patients, CPAP therapy may not be tolerated, or they may be looking for an alternative option. And rehabilitation. For older teens and adults where growth is complete and the airway is already compromised, we can work on rehabilitating function and supporting better breathing, often through collaborative care, appliance therapy, or surgical referral when needed. There is no one-size-fits-all approach. So what can we do for our children? We have an incredible opportunity to intervene early before airway and sleep turns into chronic adult health problems. By identifying the signs and symptoms early on, we can support proper growth and development, encourage healthy breathing habits, and guide the jaws and airway structures to develop the way they're meant to. In doing so, we can help stop the cycle from continuing, catching the problem when it's small instead of managing it when it becomes a lifelong condition. This is a preventative airway care, and it can truly change the course of a child's life. So how do we support healthy growth and function? First, we focus on promoting healthy nasal breathing. This means identifying and addressing any barriers to nasal breathing and discouraging or eliminating mouth breathing. Nasal breathing is critical. It filters, warms, and humidifies the air, making it easier for our lungs to absorb oxygen efficiently. Next, we look at creating more functional space for the tongue. We do this by strengthening and conditioning the tongue muscles and training the tongue to rest in the proper position, up and forward. This helps support healthy swallowing, speech, and overall oral development. Finally, we work to eliminate bad habits that can interfere with development. Things like thumb sucking, tongue thrusting, and reverse swallowing. These behaviors can all contribute to malocclusion and airway restriction if left unchecked. So by focusing on these 3 pillars, nasal breathing, tongue posture, and habit correction, we can help set the foundation for long-term health. So what can we do in adults? While we can't go back and influence growth, we can absolutely support function. For adults struggling with mild to moderate sleep apnea, snoring, fatigue, or clenching and grinding, we offer customized solutions that can improve sleep, airway function, and quality of life. We focus on stabilizing the airway, improving tongue posture and breathing patterns, and supporting restful, restorative sleep. By addressing the root cause, we're not just treating symptoms, we're supporting whole body health. Here's what an oral appliance therapy can do, even in adults. What you're looking at here is real treatment results showing how the upper arch expands over time with consistent use of an oral appliance. This expansion creates more space for the tongue, which is critical for airway function and sleep quality. Notice how the arches go from that narrow V-shaped arch to the wide and rounded arch. That's not just a cosmetic change. This expansion improves tongue posture, nasal breathing, and airway volume. So even in adulthood, we can support meaningful, life-changing improvement. First, we want to promote healthy nasal breathing. This means actively discouraging and eliminating mouth breathing whenever possible. Nasal breathing isn't just about air in and out. It's about preparing that air, filtering it, warming it, and moisturizing it so that when it reaches the lungs, it's ready to be absorbed efficiently. Next, we work on creating a more functional space for the tongue. We want the tongue to be strong, conditioned, and positioned up and forward where it belongs. This supports proper swallowing, speech, and most importantly, the airway. And finally, we looked at symptoms management. In addition to appliance therapy, there are several other treatment options we may consider depending on the patient's needs. Myofunctional therapy helps strengthen the oral and facial muscles and retain proper breathing, tongue posture, swallowing, and even speaking habits critical for long-term success, especially in children. Laser therapy can be used to reduce inflammation of the airway or treat restricted oral tissues like tongue ties, which can severely impact breathing and development. Aligner therapy, often used in teens and adults, can help gently expand the arches, improve oral posture, and create space for the tongue while straightening the teeth. And finally, for growing children and teens, fixed palatal expansion can help widen the upper jaw to support nasal breathing and reduce airway resistance before more serious issues arise. All of these tools work together towards one goal, creating a healthier airway for lifelong wellness. When it comes to airway and sleep health, we take an integrative approach. We work in collaboration with other healthcare professionals to ensure patients get the most comprehensive and effective care possible. This may include chiropractors who can help with structural alignment, sleep physicians who diagnose and monitor sleep disorders and ensure appropriate medical treatment when needed, and ENT specialists who can assess and address any anatomical obstructions, such as enlarged tonsils, adenoids, or nasal blockages that may be contributing to sleep-disordered breathing. Together, this team-based approach helps us support the whole patient, not just the symptoms. So how do we get started? The first step is the initial screening and medical diagnosis. We begin with advanced screening tools. This includes a home sleep screening device to gather essential data about your sleep and breathing patterns. We also use imaging technology to evaluate your airway and visually show you what we're seeing. This helps us understand whether your airway is compromised and what intervention might be needed. A licensed sleep physician will then review the data and provide a formal diagnosis if sleep-disordered breathing is present. This first step is crucial. It gives us the information we need to create a personalized treatment plan tailored to your needs. Step 2 is all about creating the customized treatment plan. Now that we've completed the initial screening and have a clear understanding of your airway and sleep health, we work together to build a plan that reflects your concerns and your goals. No two people are the same, and neither are their airways. Your treatment plan is designed specifically for you based on what matters most to your health and wellness. Whether your focus is better sleep, fewer symptoms, improved breathing, or long-term prevention, we tailor the approach to fit to your needs and lifestyle. Step 3, get started with treatment. Once your plan is in place, we begin treatment, supporting you every step of the way. This might include oral appliance therapy, myofunctional exercises, or other integrative approaches depending on your individual needs. Our goal is to make treatment clear, comfortable, and effective so you can start breathing better, sleeping better, and living better. We're with you throughout the process, monitoring progress, adjusting as needed, and celebrating your wins along the way. If you're interested in finding out whether we can assist you or your child, we invite you to schedule a consultation. Our team is here to help you take the first step towards better breathing, better sleep, and better health. We look forward to helping you and your loved ones flourish.